This video is on monocytosis, which is an increased concentration of monocytes in blood. I already have pictured here the bone marrow, a blood vessel, and tissue. And within the blood vessel, I'm going to draw a circulating pool of monocytes. These monocytes are free-flowing in the blood, and these are the monocytes that are sampled during a blood draw. Now, these monocytes also have cell adhesion molecules where they can adhere to the endothelial cells and enter the marginal pool of monocytes. The marginal pool monocytes can re-enter the circulating pool, or they can migrate into the tissues where the monocytes transform into tissue macrophages. Now, as for the first cause of monocytosis, it is stress. This is the most common cause of monocytosis, and we most commonly see it in the dogs, less commonly other species. And it can be due to stress caused by any illness, adrenal or pituitary tumors that are secreting cortisol or ACTH, and exogenous glucocorticoids that you are giving the animal. But whatever the cause of the glucocorticoid, this causes the cell adhesion molecules on the monocyte to downregulate, and that marginal pool of monocytes enters the circulating pool where they can be sampled during a blood draw. On to the second cause of monocytosis, which is chronic inflammation. During times of chronic inflammation, there's inflammatory cytokines which make their way back to the bone marrow and tell the bone marrow to undergo monocytic hyperplasia. This increased production of monocytes then leads to increased numbers of monocytes moving into the blood and a monocytosis. The third cause of monocytosis is immune-mediated neutropenia. Immune-mediated neutropenia is when the neutrophils, mature neutrophils, are being targeted by the immune system. So they have antibodies bound to their surface or complement bound to their surface, and those neutrophils are being destroyed. Now, in response to that, there is increased production and release of neutrophil stimulating factors, but neutrophils have a common predecessor to monocytes. So monocytes and neutrophils are closely related, and there's a lot of crossover between the stimulating factors for neutrophils and monocytes. In particular, there's something called granulocyte macrophage colony stimulating factor, or GM-CSF, which is increased during immune-mediated neutropenia and tells the bone marrow to increase production of neutrophils. But in doing so, it also increases production of monocytes as well. So there's a monocytic hyperplasia during immune-mediated neutropenia. Okay, so those are the causes of monocytosis. Most commonly, stress, which we more frequently see in the dog. Secondly, chronic inflammation due to monocytic hyperplasia. And then third, the less common of the three, is immune-mediated neutropenia, which is due to also monocytic hyperplasia in the bone marrow.